All right, so we are going to empty a colostomy bag. So remember, higher up the GI tract, the more liquid and green the stool will be. The lower the GI tract, the more formed and brown the stool will be. So you want to make sure you've got a barrier. You're going to need your washcloths, towels, graduated cylinder. This will open. For those of you that's never seen it, we've got our Velcro here. So we're going to open this up and empty this into our graduated cylinder here. Sometimes you have to squeeze this out depending on the stool consistency. You guys are lucky we're just using pudding. You guys see how squishy this is? So it can take a few minutes to really get all of this out. You want to talk to your resident, make sure that they're comfortable during this. Just keep squeezing it and squeezing it until it comes out. Remember, if there is air in the bag, you want to release that air. It can become very discomfortable for the resident and patient. You're going to take, see how much stool can be on the end of this? Now, again, this is pudding. But when it's wet like this, when it has this wet consistency, think about it, if this was poop, right? It would be all over us. So that's why you have to have towels and washcloths to really get in there and wipe this off. And believe me, this is realistic. Make sure you are being respectful during this time. This is a good time to educate. So what I have found is a wet paper towel works really good on making sure you get off all the exterior as well. If not, it will end up in the Velcro, and you do not want to have stool on the outside of this. So again, paper towels work really well. And we're going to fold it back up. If you see any like sitting right there again, take another paper towel, wipe that off. But you want to make sure nothing is on the outside. And you want to empty this as much as you can. Velcro goes back. And then you're going to take this and measure this and then empty it out and document.